This presentation is based on a Treasure Island community analysis by April Asterita and Christina Turner. Listed on this slide is an overview of what will be presented based on a community analysis of Treasure Island, Florida. In the early 1500s, the Timucua Indians inhabited what is known today as Treasure Island, Florida. In 1848, the Great Gale separated the island of Palms and Isle of Capri from Treasure Island. In 1848, pirates and smugglers chased away the existing settlers. Fishermen lived in shacks and houseboats after the Civil War. In 1908, the state of Florida sold the island to Thomas F. Pierce. In 1915, the Coney Island Hotel was built on the island, which was the beginning of Treasure Island as we know it today. It has also become a tourist attraction. Since then, Treasure Island has been built up with hotels, restaurants, of course, tourist attractions, condominiums, as residential homes. As observed during a windshield survey, Treasure Island is surrounded by water, birds, beautiful sunsets. The population density, based on the United States Census Bureau, is around 4,292 people per square mile on the island. There are 5,810 total housing units on the island, where 2,277 are owner-occupied, around 1,500 are rented, and around 2,000 are vacant housing units. The average value of the homes on the island are around $421,000. There are 5 community neighborhoods on the island, which include Sunshine Beach, Sunset Beach, Isle of Capri, Isle of Palms, and Paradise Island. Treasure Island is such a small community compared to the surrounding areas. The total area of TI is 1.6 square miles, which is significantly smaller in size in comparison to St. Petersburg being the neighboring city, having 61.74 square miles in radius. There's only one grocery store on the island, which is a Publix, one church, no schools, no library available for the residents. The city of Treasure Island is structured for the tourism, and the residents residing on the island have a complete understanding that commuting off the island is a given for the enjoyment of living on the island. The community has many retail merchandise stores that are catered towards tourists and noted while driving through the city. There are 3 bridges to get to and from the island: Treasure Island Causeway, John's Pass Bridge, and Blind Pass Bridge. This is a boating community where 3 boat ramps are available to use for residents who do not have access to the water. In comparison to the surrounding areas, structurally, the city of Treasure Island does not meet the needs of the residents regarding the convenience of having all the amenities discussed above. However, speaking with residents in TI, there's nothing like waking up and being surrounded by water and the waves of the ocean and the birds to remind them that it's all worth this compromise. Given the data above, the obvious majority of Treasure Island's population are elderly residents. Year-round, Treasure Island has been a popular place for many individuals to enjoy residing or vacationing on the Gulf of Mexico beaches and surrounding areas. Because this population has an increase in elderly residents, there's an increased concern for sedentary lifestyles that may lead to diabetes and obesity. These rates, when compared to Florida, are almost equaled. There is an efficient amount of activities to maintain an active community. This slide represents one of the many beautiful sunsets to witness while enjoying the beach. Many beach resorts, hotels, and condominiums are within walking distance. The average cost of living when compared to the entire state of Florida is 20% greater. Homebuyers and tenants may find that paying an additional amount to live in what may be considered paradise may be worth it. When compared to the national average cost of living, Treasure Island is 22% greater. The average cost of gas is approximated at $3.20 per gallon. Those who visit or reside in Treasure Island may be able to be rest assured when considering the following statistics. Treasure Island violent crime rate, when compared to Florida's, is 52% less. Florida's crime compared to the nation is 20% higher. Treasure Island is found to be 31.2% safer than other cities within the nation. 1 in 26 is what's considered the likelihood of becoming a victim of crime. Residents and vacationers may equally find the average temperature here is perfect to enjoy the city. Healthcare on Treasure Island has very limited access, acceptability, and affordability to the residents. However, Palms of Pasadena Hospital is a 24-hour, 7-day-a-week urgent care facility just over the bridge who accepts all patients. Adding primary care resources within the community will assist with assessing health care easier for primary residents living on the island.
As an older adult, community exercise and nutrition are imperative to a healthy lifestyle. Providing health education and support from a local health facility, as well as having the access of a health food store, would be beneficial for preventative health management.
Primary care office visits allow for preventative health measures to take place by providing educational tools in order to decrease obesity and illnesses related to the disease process.
For a chance to reside or just to find relaxation and bliss, vacationers and residents has an appreciation for the many resources this community has to offer. Those who are staying in the city may agree that emergent resources are easily accessible. Public safety is always a priority for the community of Treasure Island. This community has a city manager way of government. The city commission receives its information from the city manager. The city's commission is composed of a mayor, who is Robert Mining, and 4 commissioners who represent the city's 4 districts. When the group collaborates, they oversee the city's policies, annual budget is approval, and local laws and ordinances determine how the city operates. Community officials are easily accessible with their contact information and extensions listed at the following website, www.mytreasureisland.org. All official meetings are open to the public except for the closed executive meetings, which is required by law to be closed to the public. A list of meeting dates and agendas can be found at the same website mentioned above. Treasure Island reminds its beachgoers to continue to follow the rules of the beach. On an economical level, Treasure Island seems to be well adjusted to the reduction in income and the recession in the vacation industry. Of their savings, there is 4% that is from their projected budget. While still maintaining the city's recreation and event funding, the city of Treasure Island is still able to have very minimum cuts with the balanced budget. There's an ongoing at least a decade's worth of disputes amongst the city of Treasure Island and St. Petersburg for sewage treatment costs. Treasure Island believes that its city is being victimized and thinks that their community's costs should be equal to the city of St. Pete Beach, who has lesser charges. In 2014, there was an incomplete upgrade to the downtown lighting with new street poles and LED light fixtures. Treasure Island has a higher percentage of obesity than the percentage of people living in the whole state of Florida. This is a major concern because obesity can lead to other medical conditions that can all be prevented with proper nutrition and exercise. Diabetes is the second major concern for Treasure Island residents based on the fact that over 26% of the population in Treasure Island has diabetes. Diabetes can cause secondary illnesses that are also preventable. Establishing primary care facilities and urgent care clinics would allow for more convenience to the health care needs of Treasure Island residents, along with vacationers unaware of the medical facilities in the neighboring cities. The Treasure Island Community Council members should make it a priority to provide incentives for physicians to become a part of a healthier community. This could assist in decreasing the amount of obese individuals living within the community by increasing the accessibility of a physician on the island. Improving infrastructure of the community NTI or Treasure Island would be the next priority from a community nursing standpoint after health-related preventative measures have been initiated. If infrastructure is not stable, the safety and health of the community are at risk. Improvements are expected over the next 5 years. However, current renovations to lift the station for water pollution control are in progress, while aging city facility seawalls are in the works. The residents of Treasure Island have been charged an additional surcharge that dips into their pockets, which can create stress on these residents. Having a resolution to the problem can at least put the lawsuit to rest, and the community can move forward with whatever decision is made. It would be beneficial for residents and the community to have more places for home goods stores and services centers like a car wash or vegetable stands where the residents do not. Obesity is now considered a worldwide issue that has doubled from 1980 to 2014. In 2014, 13% of the world's population were obese. In comparison, the Treasure Island community alone had an adult population of 26.3%. Not only a community issue, but this is also a global issue related to the health and well-being of people all around the world. Obesity is no longer targeted towards higher financially stable countries. The problem now exists between lower and middle class countries.
Obesity is preventable. There is a global action plan set in place by the World Health Organization that promotes diet and exercise. As for the TI community, the Recreation Center has exercise classes available throughout the week to promote a supportive environment for health. A community nursing standpoint should be teaching a course in nutritional health that would be a good way to promote a healthy lifestyle and reduce obesity within the community.